Wondered if it's actually healthy after 50 or 60? Or perhaps you've privately worried that you might be causing some kind of invisible damage. If so, you're not alone. It's a topic shrouded in confusion, exaggerated myths, and a lack of clear, unbiased information. It's one of the most common concerns, especially for men in their prime. After reviewing the available data, it's easy to understand why there's so much uncertainty. Studies show that most men over 60 continue to practice solo pleasure. But many do so in the shadows, unaware of the real effects on their hormones, prostates, or even their performance with a partner. That's why today we're going to have a conversation, based on scientific data. Some potential risks you need to keep in mind to ensure your practice stays healthy. Let's start with the good news. First, it maintains penile health. The act of getting an erection increases blood flow to the spongy tissues of the penis, known as the corpora cavernosa. Think of it as a form of physical therapy. This regular exercise helps maintain tissue elasticity, which is crucial for achieving and maintaining firm erections. Second, it promotes prostate health. This is a prime example. Numerous large-scale studies, including one from Harvard University, have linked higher ejaculation frequency to a significantly lower risk of developing prostate cancer. The theory is that regular ejaculation helps release potentially harmful substances and secretions from prostate tissue. Third, it strengthens the pelvic floor. The rhythmic contractions that occur during orgasm engage key pelvic floor muscles, like the pubicoccygis muscle. A strong pelvic floor is vital for erectile function, ejaculatory control, and preventing urinary incontinence. A common problem in older men. Fourth, it reduces the stress hormone cortisol. In our high-stress world, this is an incredible benefit. Research has shown that orgasm leads to a significant drop in cortisol levels. Low cortisol helps regulate blood pressure and reduce anxiety, making it a natural tool for cardiovascular and mental well-being. Fifth, it produces a cocktail of feel-good neurochemicals. Orgasm floods the brain with dopamine, the motivational and pleasure molecule, and oxytocin, often called the love hormone. This natural stimulant offers a sense of well-being and emotional connection, which is invaluable for mental health. Sixth, it helps detect physical problems. The practice of solitary pleasure intimately familiarizes you with your own anatomy. This self-examination is one of the most effective ways for men to discover immediate signs of conditions such as testicular cancer, penile fibrosis, or other abnormalities that might otherwise have gone unnoticed. Seventh, it improves sleep quality. After orgasm, the release of hormones like oxytocin and prolactin combined with the reduction of cortisol creates a powerful sedative effect. This helps the body relax deeply, facilitating restful sleep, something that often becomes more difficult with age. It improves pelvic blood circulation. In general, beyond the penis, the health of the prostate, testicles, and surrounding muscles, thus preventing problems related to stagnation and poor circulation. Second, it can serve as a training method for ejaculatory control. For men who struggle with ejaculation, stop method. This allows you to better understand your body's signals and create more control, which can then be translated into sexuality with a partner. 10. It keeps your sexual desire and neurological circuits active. The brain is the largest sexual organ. By regulating sexual fantasy and physical stimulation, you maintain the neural circuits associated with sexual desire and response. This helps maintain a healthy libido and sexual responsibility, even if you don't have a regular partner. But to get the full picture, we can't just focus on the positives. A healthy practice is a conscious practice. So now let's talk about the 10 potential risks or negative effects you need to be aware of. The first risk is social isolation. This becomes a problem when solitary pleasure ceases to be a part of a healthy sex life and instead becomes a substitute for real human connection. The solution here is awareness. Make sure this practice complements your life rather than allowing you to escape it. The second is performed too aggressively or without proper lubrication. These small injuries can cause irritation, inflammation, and even become a gateway for infection. The solution is simple. Always be gentle and use a quality, water-based lubricant. The third risk is desensitization. If you stimulate yourself in the same way, with the same pressure and rhythm, every time, your brain can become conditioned to only that type of touch. This can make it difficult to achieve orgasm with a partner. The key is to vary your technique, rhythm, and approach. The fourth risk can mask the underlying causes of but not with a partner. It may be tempting to ignore the problem. However, this can mask underlying health issues such as heart disease, diabetes, or hormonal imbalances. If you notice this pattern, it is essential to seek medical help. Pudendrum nerve in the pelvis. Over time, this can lead to genital numbness or pelvic pain. Ideally, you should practice in a relaxed and comfortable position, such as sitting, with good support. The sixth risk is that it can become an anxiety, or frustration can create a behavioral addiction. It is crucial to have a range of tools to manage your emotions, including exercise, meditation, and dialogue with others. The seventh risk is feelings of guilt and shame. Many men were raised with cultural or religious taboos regarding self-pleasure. If these feelings persist and cause you stress, it can be extremely beneficial to speak with a sex-positive therapist or counselor to help reinforce this natural practice in a healthier light. The eighth risk is pelvic congestion. Infrequent ejaculation is a risk factor for prostate problems, but excessive ejaculation several times a day for a long period of time can sometimes lead to a feeling of heaviness or pain in the testicles and pelvic area. The solution is moderation. Listen to your body's signals. The ninth risk is a potential impact on sperm quality. This is only a concern if you and a partner are actively trying to conceive. Although it won't harm your long-term fertility, daily ejaculation can temporarily reduce sperm concentration. For optimal quality, studies suggest that a 2 to 5 day abstinence period is ideal. And finally, the 10th risk is a disconnect from connect with a real partner. The key is to balance any visual being with your own imagination and memories of real, satisfying experience. So, as you can see, late life experience, how you use it determines its effect. The secret ingredient is always awareness, practiced with awareness, respect for your body, and moderation. It can be a powerful and wonderful ally for your health and vitality. I hope this conversation has been helpful to you. I'd love to hear your thoughts. What was the most surprising point for you today? Leave a comment below. Let's continue this important discussion together. If you found value in this video, please like it and subscribe for more mature health tips. Don't forget to turn on the notification bell so you don't miss the next conversation. Take care and see you in the next video.